If I walked into a hospital room tomorrow morning and saw that a stroke had happened during the night, one of the questions I would quietly ask myself is this: what was happening while that person was sleeping? Not just their blood pressure, not just their medications, but their breathing, their oxygen, the way their neck was positioned, and yes, even the way they were lying in bed. Because one of the most overlooked dangers for older adults is that the body does not fully switch off at night. In some people, it becomes more vulnerable. And one very common sleeping position can make that vulnerability worse. I'm Dr. Thomas Reynolds, and if you're over 60, this is something I want you to hear with a calm mind, not a fearful one. I'm not here to scare you. I'm here to help you understand what many older adults are never told until after a problem begins. Tonight, before your head touches the pillow, I want you to know which sleeping position concerns cardiologists the most, why it can raise stroke risk in certain seniors, who needs to be especially careful, and the simple changes that may help protect your brain, your heart, and your independence. Because that is really what this conversation is about. Not just stroke. Independence, clarity, balance. Being able to wake up, get dressed, think clearly, walk steadily, and live life on your own terms. And here is the important contradiction. Many people assume that if they are asleep, resting, and not moving, they must be safer. But that is not always true. For some older adults, nighttime is when oxygen drops, blood pressure shifts, heart rhythm becomes unstable, and blood flow to the brain may become less reliable. The body is quiet, yes, but inside, there can be a traffic problem. The position that worries me most is sleeping flat on the back, especially in older adults who snore, have sleep apnea, carry extra weight around the neck or abdomen, wake up tired, have high blood pressure, atrial fibrillation, diabetes, heart failure, or a history of mini strokes. For those people, lying flat on the back can allow the tongue and soft tissues of the throat to fall backward, narrowing the airway. In plain English, the breathing tube becomes partially blocked. Air still moves, but not well. Sometimes it stops for brief moments. Oxygen dips. Stress hormones rise. Blood pressure surges. The heart has to strain. And the brain, which depends on steady oxygen and steady blood flow, is suddenly being asked to function in a storm. That is why I want to walk you through the 5 nighttime problems that can make this back sleeping position more risky after 60, and then I'll show you what you can do about it in a practical, realistic way. The first problem is airway collapse. Most people think of the throat as a fixed pipe. It isn't. It's more like a soft hallway made of muscle and tissue. When you're awake, those muscles help keep the hallway open. But when you fall asleep, the muscles relax. If you lie flat on your back, gravity pulls that soft tissue backward. In younger adults with strong muscle tone and a wider airway, that may not cause much trouble. But after 60, tissues become looser, reflexes slow down, and the airway can narrow more easily. This matters because the brain is extremely sensitive to oxygen changes. It doesn't store oxygen the way a pantry stores food. It needs a steady delivery, minute by minute, second by second. If your breathing repeatedly slows or pauses at night, oxygen levels may dip over and over again. Your body responds like an alarm system going off. Heart rate changes, blood vessels tighten, blood pressure can spike. In some people, that repeated stress is one of the reasons stroke risk rises. And here is what makes this so deceptive. Many seniors do not know it is happening. They may not remember waking up. They may simply notice morning headaches, dry mouth, daytime sleepiness, poor concentration, or the feeling that they slept all night but still woke up exhausted. That is often not just aging. That is a clue. If you sleep on your back and snore loudly, choke in your sleep, wake up gasping, or have been told you stop breathing at night, do not brush that off. Ask your physician whether you should be evaluated for sleep apnea. Sometimes a home sleep study is enough to begin the conversation. And if you already use a CPAP machine but stopped because it felt uncomfortable, that does not mean the problem disappeared. It means the treatment needs adjustment. Mask fit, pressure settings, humidity, even the style of mask can often be improved. Before we go further, if you're listening right now, I'd love to know where you're watching from and your age. I always find it encouraging to see how many people in their 60s, 70s, and 80s are still actively learning, protecting their health, and refusing to give up control of their future. The second problem is blood pressure instability during the night. Many older adults focus on the numbers they see in the clinic. But what happens while you sleep can be just as important. Normally, blood pressure should settle down during the night. Think of it like a car engine idling more quietly. But when breathing is repeatedly interrupted, or when the body is under strain from a poor sleep position, the engine revs. Tiny surges of stress hormones can push blood pressure higher again and again. Why does this matter for stroke? Because the blood vessels in the brain are delicate. Over time, repeated pressure surges can damage the lining of those vessels. That lining is like the smooth inner coating of a pipe. When it gets irritated, inflamed, and worn down, the risk of blockage or rupture may rise. That doesn't mean one bad night guarantees a stroke, but it does mean the night is not as harmless as many people assume. This is especially relevant if you wake up with pounding headaches, feel your heart racing at night, or have controlled blood pressure in the office but still struggle with fatigue and brain fog in the morning. Some patients even tell me, "Doctor, I feel worse when I first wake up than I do later in the day." That deserves attention. A helpful step here is to take your nighttime health seriously, not just your daytime health. If your doctor recommends it, ask whether ambulatory blood pressure monitoring or a sleep evaluation would help. Keep a record of symptoms. Do you wake up at 3 a.m. short of breath? Do you fall asleep in a recliner because bed feels uncomfortable? Do you nap all day because the night never feels restorative? These details matter. They are not trivial. The third problem is heart rhythm disturbance, especially atrial fibrillation. Now this is where cardiology and stroke prevention connect very directly. Atrial fibrillation, or AFib, is an irregular heartbeat that becomes more common with age. Instead of the upper chambers of the heart squeezing in a smooth rhythm, they quiver. When that happens, blood may pool and swirl instead of moving forward efficiently, and pooled blood is more likely to clot. If a clot forms and travels to the brain, a stroke can happen. So where does sleep position come in? If sleeping flat on the back worsens airway obstruction, that repeated cycle of low oxygen and sudden arousal places stress on the heart's electrical system. It's like flickering power running through old wiring. In people who are already vulnerable, that unstable nighttime environment may trigger or worsen irregular rhythms. This is one reason some older adults wake with palpitations, chest fluttering, or a strange, unsettled feeling in the chest. They may blame anxiety, and sometimes anxiety is part of it, but not always. If you have AFib, high blood pressure, prior stroke, or heart disease, the position you sleep in may not be a small detail. It may be part of the larger picture. Please hear me clearly. Do not stop or change any blood thinner, heart rhythm medicine, or blood pressure medication on your own because of a video. But do bring these issues to your physician. If you've been told you snore heavily, and you also have AFib, that combination deserves respect. It is not something to casually ignore. The fourth problem is poor circulation and fluid shift. As we get older, fluid balance changes. Veins may not return blood as efficiently. Some people hold extra fluid in the legs during the day, especially if they have heart failure, kidney disease, or spend long hours sitting. When they lie down at night, that fluid can redistribute upward. The tissues around the neck may become more crowded. Breathing can worsen. Some people notice that when they lie completely flat, they feel pressure, cough, or wake up needing to sit upright. This matters because the body is a connected system. If breathing gets harder, sleep becomes fragmented. If sleep becomes fragmented, inflammation may rise. If inflammation rises, blood vessels become more irritated. If circulation becomes sluggish and the heart is strained, the brain does not get the stable support it needs. Nothing happens in isolation. The simple image I often use is this. Imagine your body as a house with plumbing, wiring, filters, and an air system. At night, all of those systems still have to work together. If the airflow is blocked, the pressure builds. If the pressure builds, the wiring flickers. If the wiring flickers, the pump strains. And the room you most want to protect is the brain. What can help? For some older adults, a slight elevation of the head of the bed, or using a wedge pillow rather than stacking soft pillows, may reduce airway crowding and reflux while supporting easier breathing. Side sleeping, particularly if it can be done comfortably, often reduces snoring and airway collapse compared with lying flat on the back. But the key is safety and comfort. If you have severe shoulder pain, balance problems, advanced arthritis, or breathing disease, the best position may need to be individualized with your doctor or sleep specialist. And that brings me to the fifth and most important point. The danger is not just the position itself. It is the position plus the warning signs people ignore. This is where many seniors get caught off guard. They think, I've slept this way for 30 years, so it must be fine. But aging changes the equation. Muscle tone changes. Weight distribution changes. Blood vessel stiffness changes. The brain becomes less forgiving. What your body tolerated at 45 may not be what it tolerates at 75. So let me give you the warning signs I never want you to dismiss. Loud snoring. Witnessed pauses in breathing. Waking up choking. Morning headaches. Dry mouth. Daytime sleepiness. Memory lapses that seem worse after poor sleep. Needing multiple naps. Unexplained high blood pressure. Atrial fibrillation. A previous TIA, which is a mini stroke. Waking confused. Feeling like your sleep is never truly refreshing. If several of those are true for you, the question is no longer, what is my favorite sleeping position? The question becomes, what sleeping setup gives my brain and heart the safest environment through the night? And here is the good news. You do not need to panic. You do not need to become afraid of bedtime. You need a plan. Start with this. If you usually sleep flat on your back and you have any of the risk factors I mentioned, try working towards side sleeping if it is physically comfortable and safe for you. A pillow behind the back can help prevent rolling flat. A pillow between the knees may reduce hip strain. If side sleeping is difficult, elevating the upper body slightly may still help. Avoid heavy alcohol near bedtime because it relaxes the throat muscles even more. Be cautious with sedatives unless they are being carefully managed because they can deepen airway collapse in some people. Keep your nasal passages as clear as possible. Treat congestion. And if you wear dentures, talk with your clinician if nighttime fit or jaw structure seems to affect breathing. Also, do not underestimate weight, neck size, and abdominal pressure. Even modest weight loss in some older adults has been linked to improved breathing during sleep. I know that is not easy. I know many of you are dealing with painful knees, fatigue, and medications that make weight management harder. But even small steps matter. A lighter load on the chest and neck can mean easier airflow at night. If you're finding this helpful, take a moment to like the video and subscribe. Not for me alone, but because this kind of information helps more older adults realize that many of the changes they feel are not random. They are connected. And once you see the pattern, you can do something about it. Now, I also want to protect you from another mistake. Some people hear a message like this and think, then I'll just never sleep on my back again. But medicine is rarely that simplistic. There are exceptions. Some people with certain pain conditions, spinal issues, or other disorders may need special positioning. The real message is that sleeping flat on the back becomes especially concerning when it combines with snoring, oxygen drops, apnea, high blood pressure, heart rhythm problems, or prior vascular disease. Risk lives in the combination. That is why I want you to think in layers. Position, breathing, blood pressure, heart rhythm, symptoms, medical history. Put those layers together, and the picture becomes much clearer. And if you live alone, this becomes even more important because many nighttime warning signs are silent to you. You may not know you stopped breathing. You may not hear your own snoring the way another person would. In that case, a sleep study can be incredibly valuable. It gives you information your body has been trying to send, but in a language you may not have been able to hear. Let me end with this. Aging does change the body. That is true. Blood vessels may stiffen. Sleep may become lighter. Recovery may take longer. But common is not the same as harmless, and common is not the same as untouchable. Small nightly habits still matter. How you sleep matters. How you breathe while you sleep matters. And the choices you make before bedtime may help protect far more than rest. They may help protect your memory, your balance, your confidence, and your ability to keep living life with dignity. If you remember one thing from today, remember this. For many older adults, especially those with snoring, sleep apnea, high blood pressure, heart rhythm issues, or prior stroke risk, Sleeping flat on the back is not always the safest choice. The body may look peaceful on the outside, while on the inside it is working too hard. And when you reduce that strain, you may be doing something very meaningful for your brain and heart. You do not need perfection. You need awareness. You need consistency. You need the willingness to make one smart adjustment tonight, then another tomorrow, and keep going. That is how health is protected after 60, not through fear, through steady, informed choices. I'm Dr. Thomas Reynolds, and I'd love to hear from you in the comments. Do you sleep on your back, your side, or in a reclined position? Have you ever noticed snoring, waking up tired, or morning headaches? And if this message helped you see your nights differently, subscribe and stay with us. There is still so much you can do to protect your independence, your vitality, and your future.